Hello everyone, how are you all? Welcome to our YouTube channel for Nurses Preparation. I am Neeraj Kumar Kathal. Today we are presenting heart sounds. Let's begin our today's video. There are total 4 heart sounds are present. Let's talk about the first heart sound. First heart sound also known as S1. This heart sound is generated due to closure of AV valve or atrioventricular valves. First heart sound heard loudest at the apex of heart. Apex part of heart is a pointed or tip of heart that is located in the left side of a person at fifth intercostal space. Let's see the diagram. This is the rough diagram of heart. These are the upper chambers of heart, right atrium and left atrium. These are the lower chambers, right ventricle and left ventricle. The valve found between the right atrium and left ventricle known as right AV valve or right atrioventricular valve. This valve is also known as tricuspid valve. Valve found between the left atrium of heart and left ventricle known as left AV valve or left atrioventricular valve. These valves also known as mitral valve or tricuspid valve. Now let's talk about the second heart sound. Second heart sound also known as S2 sound. These sounds are generated due to closure of semilunar valves. What are the semilunar valves? Let's see the diagram. This is the rough diagram of heart. This is the right atrium, this is the left atrium, this is the right ventricle and this is the left ventricle. From right ventricle to pulmonary arteries are connected. At their junction, valves are present. These valves are known as pulmonic valve or pulmonic semilunar valve. In the left ventricle, aorta is connected. At their junction, a valve is present. This is known as aortic valve or aortic semilunar valves. So, pulmonic and aortic are the two types of semilunar valves. When these valves are closed, at that time the sound is produced known as second heart sound or S2 sound. Next point, second heart sound heard loudest at the base of heart. Second heart sound heard loudest at the base of heart. You can take a screenshot for your revision. Now let's talk about the third heart sound, that is also known as S3 sound or ventricular gallop or protodiastolic gallop. S3 sound heard if ventricular wall compliance is decreased and structures in ventricular wall vibrate. This can occur in conditions such as heart failure or valvular regurgitation. S3 sound produced when ventricular wall compliance decreases and at that time structures found near ventricular wall have vibrations and due to this S3 sound produces. This condition normally occurs in a person who is suffering with heart failure or valvular regurgitation. Simply we can say heart failure is a condition where heart is unable to pump sufficient amount of blood in the body according to the body's demand. At that time, heart's ventricular try to push the blood forward to fulfill the demand, but due to failure there is not complete ventricular contractions and this time vibrations are generated. Due to that, third heart sound is produced. Next point, However, S3 sound may be normal in individuals aged below 30 years. In some cases, few people have this S3 sound below age 30 and they are absolutely normal. You can take a screenshot for your revision purpose. Now let's discuss about the last hertz sound, that is fourth hertz sound. It is also known as S4. We can call it as atrial gallop or pre-systolic gallop. Now let's talk about how these sounds are produced. S4 sound may be heard on atrial systole if resistance to ventricular filling is present. Suppose this is the upper chamber and this is the lower chamber. When the upper chambers or atria of the heart contract, blood passes from atrium to ventricular. At this time, if there is any resistance while filling ventricles, this time fourth hertz sound is produced. When the blood moves from atrium to ventricular, if there is a resistance and due to this resistance sound is produced known as S4 sound. This is the about production of the S4 sound. Now let's talk about the point number 2. It is the abnormal hertz sound. S4 hertz sound is completely abnormal. Next point, what are the important causes of production of S4 sound? First, cardiac hypertrophy. Cardiac hypertrophy means cardiac cell size increases. Hypertrophy means increase in size. And hyperplasia means number of cells increases. So there is a increase in the cardiac cell size. This is the important cause of S4 hertz sound. Second is diseased or injured ventricular wall. If there any kind of disease or injury in the ventricular wall, due to this S4 sound may be produced. You can take a screenshot for your revision purpose. So friends, this was all important about hertz sound. This is a very important topic regarding I Norcet exam 2021. If you think this video is helpful, then please click upon the like button, share this video with your friends and subscribe our YouTube channel for nurses preparation for more such interesting videos. Thanks a lot. All the best.